Good afternoon. I'm presenting in my paper Prevalence of Ocular Abnormalities in Children with Autism Spectrum Disorder. So the primary objective of my study was to determine prevalence of ocular and visual anomalies in students diagnosed with autism spectrum disorder and the effect of the interventions. It was done as a descriptive study conducted at a tertiary care rehabilitation center in the central Kerala from June 2023 to June 2025. We included a sample size of 190 children with confirmed cases of autism spectrum disorder. Our team was a multidisciplinary team which consisted of a pediatric ophthalmologist, pediatric optometrist, developmental pediatrician, occupational therapist, clinical psychologist, as well as a speech therapist. We did a comprehensive evaluation protocol on every kid, starting from the demographic details, and we assessed the visual acuity using age-appropriate testing like Lee Symbols chart and Snellen's chart. Subjective refraction was done in all the cooperative subjects to determine the refractive status, and cycloplegic retinoscopy was done in all the 190 students. And we also included a strabismus evaluation, anterior segment evaluation, as well as a dilated fundus examination. So we classified the whole study group into two, as group 1 with the refractive error and group 2 with no refractive errors, and which was based on All India Ophthalmological Society consensus guidelines for pediatric review correction. For the study purpose, we defined the refractive errors as myopia with more than minus 0.5 diopter sphere or equivalent or subject refraction or equivalent in cycloplegic retinoscopy, hypermetropia plus or minus plus more than or equal to plus 0.5, and cylindrical component more than 0.5 diopter cylinder on subjective or cycloplegic retinoscopy was evaluated in the astigmatism group, and any child presenting with astigmatism more than 0.5 diopter cylinder or greater were included in astigmatic group for the analysis. So after the analysis, we found out that the mean age group of the population was 5.25 years, and it was a male predominant study population with 71.1% as males. We classified the students into different categories of severity of autism spectrum disorder into mild, moderate, and severe based on Indian scale of assessment of autism. And we found out that among the study population, 64.7% of students had abnormal visual parameters according to the IS guidelines, whereas 35.3% children had a normal visual parameters. We categorized into different subgroups of ASD, which again followed a similar pattern. All the subgroups of ASD were having a high prevalence of visual anomalies. And in our study, we found out that astigmatism was the most common refractive error found in the population, followed by hypermetropia and then by myopia. We evaluated the subgroups of ASD with respect to this refractive errors, and mild and moderate cases of mild and moderate categories of ASD followed a similar trend wherein astigmatism was the commonest refractive error. And additional findings that we could found out was we found 5 cases with strabismus, among which 4 were exodeviation and 1 was a esodeviation. And all the children were given spectacle corrections according to the guidelines. And we saw that 19.55% students had an improvement in visual acuity after spectacle correction. So it demonstrated a significant clinical benefit in nearly 1/5 of the study population, confirming the importance of early detection and intervention. So coming to the discussion part, autism spectrum disorder is a neurodevelopmental disorder with prevalence ranging from 0.09 to 1.07 among the population between 0 to 17 years in India. So in a study population conducted in South India, it revealed that the refractive errors and strabismus as a main ocular pathology in general population with the prevalence of 0.55% and 0.43% respectively. In the present study of refractive errors and strabismus was much higher in the study group when compared to the general population of non-autistic children. This indicates that the children with ASD have a very high propensity for developing refractive errors than the general population. So this is a comparison between the available literature lens. So it is very evident that our sample size was quite high, 190. And all the studies were not exactly dominating on the ASD part. They were also studying on the other parameters, but our study was mainly focusing on the children with autism spectrum disorders, and our study included all cycloplegic retinoscopy for all the study subjects, whereas it was lacking in the other studies. And the difference that we could found out in our study population was astigmatism was the highest, most common refractive error, whereas most of the other majority things were getting as hypermetropia as the most common thing. So as a conclusion, ocular abnormalities in children with autism spectrum disorder exceed the general population rate, requiring a very vigilant screening protocol. Optimal timing is very crucial, which enables adequate visual rehabilitation and better outcome, which improves the quality of life. Thank you.
Very nice study.
Thank you.
And wasn't it challenging to check the refraction for these children?
Yes, ma'am. Very nice.
It would have been very challenging. So do you think they are compliant to using the glasses?
Most of the kids were compliant, but I think it needs an extrapolation on that part too. I considered that was a limitation of my study.
Okay, and one more thing is, do you think this astigmatism was caused by the rubbing? I mean,
There
sometimes
could be
these
one
kids
chance
that they
there could
might be
rubbing
rubbing
among
their
the
eyes.
children. And other thing maybe slightly due to the inclusion criteria that I included the patients with even 0.5 diopter cylinder was included in the astigmatic group. So maybe the inclusion criteria, I'm not sure whether it had
The methodology.
better, yeah.
So did you have a follow-up to see whether the refraction improved or remained the
Yeah,
same?
1 month follow-up.
Good that you have undertaken this study. And did you also look into the functional aspects of vision, like CVI?
No, we have not
Yeah.
included that.
In future studies, you can look into that also, because I think almost 30 to 40% incidence of CVI is there in children with autism. And even with a good visual acuity, sometimes they may not be able to perform well. Okay.